Hi, this is Rose Nide, and if you are watching this, you're probably pretty terrified because your dog may have just been diagnosed with parvo. Recently, this happened to me, and I was terrified because about 30 years ago, I had got a puppy from the San Francisco Humane Society, and within a couple of days, it got parvo. I tried everything to save it, and unfortunately, it didn't make it. This time around, I had been so careful about where I took my puppy and what we did together, and I don't know how she got parvo, but she did. I took her to the vet in the morning because she had had diarrhea all night long. By the time morning came, it was real watery, and I asked them immediately to test for parvo. They did, and it came back as a light positive, which means that it probably just got started. So I immediately took her to an emergency ward because, at least where I live, most places won't treat parvo because they don't have the ability to keep them there 24/7, which sometimes is what they really, really need. When I got there to the emergency, I finally got in to talk to a doctor, and I was told that there was a new antibody. And this new antibody, it's called a monoclonal antibody treatment, or CPMA, and it's highly effective, and it significantly improves the survival rates and reduces the severity of the disease. It says that 93% of treated puppies survived, which is amazing, and it treats it faster, and they have a resolution to the symptoms like vomiting, lethargy, and lack of appetite faster as well. I opted to go ahead with that because I had talked to some other people and they said it's a game changer. So, of course, when you're in an emergency ward, you want to do everything you possibly can to save your baby. And, of course, unfortunately, emergency wards are very expensive, and they know that they're pulling at your heartstrings, and you will do anything to save them. They presented the bill of quotes of what it would cost for me to keep the dog there for 2 to 4 days. That was $5,500 to $8,500 and may not include all medications, which I was like, oh my God, I can't afford that. So what I opted to do was go ahead and have that antibody given to her. It's one shot, and depending on the size will depend on how many vials they will need to use. My dog was 30 pounds, so she needed 3 vials, but I opted to have it done. That shot alone was $1,400. On the web, you're seeing them supposedly for about $200, but again, this was an emergency ward, so, cha-ching, cha-ching. So anyway, I did that, and then I went ahead and got the sub-Q. I had a friend that didn't have a dog come to my house and help me administer the sub-Q fluids for about 2.5 days. And so far, so good. It's been over a week. She's never lost her energy. She's been eating. She has been drinking. She has been urinating. She went without having a defecation for about 4 days. That concerned me, but she finally has. And they're not perfect, but she's on the road to recovery. So I just wanted to give you an idea of, if you have a dog that happens to have parvo, this is made by a company called Elanco, and it's a CPMA treatment. It's a one-time shot administered in the beginning for puppies over 8 weeks of age, and I highly recommend it. Obviously, I'm not a vet, and you would need to talk to your veterinarian about it, but I think it's the way to go. Again, I couldn't afford to have my dog stay at the emergency ward, so I did opt to take her home, and that worked out really well. I think that the antibody is a game changer. I highly recommend it, and I wish you all the best. I know how stressful and frightening it can be, but, try to find a vet that actually has this antibody, and I would suggest using it. Okay, all for now, and say a prayer for my little girl. Thanks.